So, what are the benefits of telemedicine? First, to the patients, a study by Polanski et al. Showed an overall satisfaction due to its convenience and flexibility. Also, one third of the more than 3,000 survey participants in the said study preferred telemedicine over traditional visits. In addition, the most significant reason for liking telemedicine was the lack of medical insurance. Second, patient benefit would be access. Traditionally, telemedicine was used to provide healthcare services in the rural areas, and a study by Nesbitt and Company have shown that the introduction of telemedicine in rural communities have changed the patient's perception of the quality of locally delivered healthcare. Another use of telemedicine was to provide access or primary care access to the rising number of the aging population. Currently, for access, telemedicine has been the primary mechanism of care delivery during this COVID-19 pandemic. Most of the follow-ups for chronic diseases and malignancies were provided using this platform. As to the providers, yeah, it supported patient-centered care. It was noted that there was a significant reduction in time that it took for them to coordinate care and communication or transfer of information from the between the physicians, patients, and their families. It also provided the physicians or providers with the benefit of flexibility, as they don't have to travel to remote places to see their patients. Another benefit would be reducing the risk of infection from both parties. Third benefit for the providers is the improved reimbursements due to this COVID-19 pandemic. Medicare and Medicaid reimbursements for telemedicine in all 50 states and Washington, D.C. have been implemented, and most states have laws that require commercial payers to pay at the same rate as in-person visits. It was also noted that many patients were willing to pay out of pocket for non-covered virtual visits. And lastly, many states have eliminated the rule for billing virtual visits only with established patients. Recently, 9 telehealth benefits were now approved to be permanently covered by Medicare within the confines of the rural regions. And this include group psychotherapy, some home visits, and cognitive assessments. Also, nearly 60 other telemedicine services will be temporarily extended until the end of 2020.